Hi, I'm Don Thompson, Marketing Director at Carrystream Health, and I'm here today with Russ Kane. Russ is with St. Alexius from North Dakota. They are about a 200-bed hospital, a level 2 trauma center, and we were talking about the new detector that we have here. We've got the new Lux glass-free detector, and he has an interesting background in kind of human interfacing with machines, and he had some ergonomic comments that he wanted to make about that. So I was showing him the 35 by 43 detector, which he would hold, and then I would show him the glass-free Lux detector, and he can hold that one and see the difference in weight. And this actually 2-pound weight kind of shows the difference, if you will, with the weight of these detectors. Here, I'll grab that one. So that's the difference in weight. So tell us a little bit about what you think the real value would be to the techs or the radiology director as far as less breakage, how this fits under the patient, all that kind of thing.
Okay. 2 pounds doesn't sound like a lot when you're talking about it, but when you're a technologist who's 5'1" and weighs 90 pounds, and you're trying to deal with a 200-pound patient and the plate, that's a lot of weight. Technologists, like nurses, often injure their backs. If they have to bend over and lift this weight or have to extend it out, that's more stress to the body. Something called human factors engineering, which is a subset of industrial psychology, talks about this human-machine interface, which is the key to ergonomics. And basically, it is increasing the patient safety and increasing the staff safety. There's less stretching, reaching outward. You're moving from the appropriate dynamics of the body, and taking that 10 pounds and holding it out, or that 2 pounds and holding this plate out here is much different than using that additional 2 pounds. And there's other economic features on the system that do the same thing. Where you place the plates avoids breaking it sometimes. Removing the glass, which makes it a little less fragile, also helps the weight. Makes it more user-friendly for the technologist, more user-friendly for the folks in clinical engineering as well.
What about, Russ, you were mentioning how there have been occurrences in the past where every once in a while someone will drop a very expensive DR plate, obviously this being glass-free and so forth. Tell me about what your thoughts are on the value of that to the facility.
Well, that goes back to it's less fragile, so that means there's less breakage, or should be. Technologists, by handling it a lighter weight, are less prone to drop it. When they do, the breakage, there are still some facilities who don't have the insurance, and even if they do, there's an expense involved. Those who don't, we're talking about a lot of money to replace the plate that was dropped. And I used to tease techs, yeah, that's your next paycheck, or that's your paycheck for the rest of the year. Yeah. And you can encourage safety, but accidents do happen no matter how careful people are. The facility I'm at right now, knock on wood, we haven't dropped a plate since I've been there, but the staff is very, very careful. But with that said, I'm sure at some point we're probably going to have one dropped. With this particular plate, I would guess it would be less prone to break when it is dropped.
Okay. All right. Thanks, Russ. Thank you very much.
Thank you.
Thanks for your time.